Hello, I'm Dr. Mark Dailey, and I want to thank you so much for allowing us to be part of your fibromyalgia group. After working with fibromyalgia patients for over 10 years, I wanted to share some of my insights with the group as a whole in hopes of benefiting each of you individually. I want to be very clear that what I share on this video is not intended to take the place of your primary care physician's instructions. That, of course, is between you and your doctor. Though I plan to share individual strategies to reduce the symptoms of fibromyalgia, I do believe that fibromyalgia in most cases is a multi-system breakdown. So there is not one single cure. There are things that may help an individual, but no two fibromyalgia patients are exactly the same either. So in my experience, again, fibromyalgia is a multi-system breakdown, which means it involves the gastrointestinal system, the immune system, the endocrine system, and of course the nervous system, including the brain. Now that doesn't mean that fibromyalgia can't be defeated and overcome, but there is a strategy to bring all these systems back into proper function, and it's a process. It doesn't happen overnight. So the last thing I want to do is pretend like there is a magic pill for the fibromyalgia patient, because that simply is not true. One last thing I want to mention before I get into our topic. It is foolish to expect results without making change. And I recognize that change for all of us is very hard. And you, as a fibromyalgia sufferer, actually have more power than you're aware of. Most of you on this forum are hungry to learn how you can defeat fibromyalgia and get your life back. The truth of the matter is that you have to apply what you learn as you share with one another. And that may be changing the way you eat, the way you deal with stress, the exercise you do or you don't get, and the supplements that you take. Now, today I want to share with you an interesting link, some of you may be familiar with it, between vitamin D deficiencies and chronic pain. Not getting enough vitamin D in your system may be linked to chronic pain. Over the past 10 years, several researchers have found an association between extremely low vitamin D levels and chronic generalized pain that doesn't respond to treatment. Now, for many fibromyalgia patients, you can say amen or raise your hand because it's true for many of you. Many Americans are running low on vitamin D. A study published in the Archive of Internal Medicine in 2009 showed that vitamin D levels have plummeted among all United States ages, races, ethnic groups over the past 2 decades. Dr. Greg Plotnikoff, he's an MD, senior consultant with Alina Center for Healthcare Innovations in Minnesota, remembers a woman in her 40s who told him that he was the 30th doctor that she'd seen. And I've experienced that too, people getting a new patient that has been to multiple doctors. 12 of these doctors told this lady she was crazy. She had weakness, aches, fatigue, 3 pages worth of symptoms. Doctors had offered her antidepressants, seizure medications, and all kinds of things that basically didn't work. After checking her vitamin D levels, they came back barely measurable. After 6 months on an aggressive high-dose prescription vitamin D replacement, the woman could cross off every symptom on her 3-page list. That's just one woman. Keep in mind, her case doesn't mean vitamin D will erase pain for everyone. But the study, there was another study published in 2003 on 150 people in Minneapolis, Minnesota, who came to a community health clinic complaining of chronic pain. Virtually all of them, 93%, had extremely low vitamin D levels. So vitamin D blood levels of 30 to 40, from a medical perspective, are considered ideal. Now, I'm a functional medicine practitioner, and we like to see the levels above 70. The average level in this study was about 12. And some people had vitamin D levels so low, they were undetectable. The group with the lowest levels of vitamin D were white women of childbearing age. Most of them were dismissed by their doctors as being depressed or whiners. And I know some of you probably have been treated that way as well. They attribute their pain to an inability to manage stress. But after replacing the vitamin D levels, these people actually got their lives back. So this is something I frequently see in my practice as I work with fibromyalgia patients. For most patients, fibromyalgia is a multi-system breakdown. As I said earlier, for many, vitamin D plays a role. For a few, it's actually the major contributor. The nice thing is that vitamin D is cheap enough to try it for 6 months and see how it affects your symptoms. And keep in mind too that not all vitamins are created equal. You need to be very, very, very careful when you buy them. You definitely want to get pharmaceutical grade. You don't want to buy retail outlet vitamins. They've been proven time and time again in many cases not to have what they say is in them, let alone the amount they say is in them. I'll put a link up somewhere here on this video to show several good brands of vitamin D. Now, something that's important for you to realize is that on a given day, you use about 4,000 international units of vitamin D. So you could safely take 10,000 international units a day for several months and then ask your primary care physician to check your levels, because it is fat soluble and potentially you could have a toxicity issue, but that won't happen overnight, and that doesn't happen for folks that actually have very low levels. If you want to know more about the work that I do, feel free to visit one of our websites. I have free resources and materials there I would love for you to take advantage of. But I want to thank you so very, very much for your time and your attention, and I wish you the very best of health.